population, life expectancy, I think it dropped to around maybe 35, 34. Now, 65, almost hitting 70. It is a success story. We're talking about polio, we had polio, but now we have managed to contain it. It is doable. It is a success story. And so we just need to have, a smart network, collaboration as well, and also, trust, transparency, and accountability in everything, from the giver and the one who is receiving. On both sides, there has to be accountability and transparency.
Accountability and trust. I think those are great words to end on. Congratulations again on the polio achievement. That's fantastic. Thank you so much for sharing your insights and your call to action with us. We really appreciate it. Minister Chaponda.
Thank you. Thank you. Thank you.
Lois Pace, the U.S. Department of Health and Human Services Assistant Secretary for Global Affairs, for a conversation with moderator Dr. Maisha Alam, Foreign Policy's Vice President of Research, on the interconnected challenges of health, climate, and security.
Room. Yeah.
Hi, good morning, everybody. It's wonderful to be here with all of you in person in Geneva, and of course to our global audience online. Thank you so much for tuning in. I'm really honored to have the opportunity to sit down with Assistant Secretary Pace this morning for what, as we heard just now, is perhaps one of the most complex but critical challenges of our time. In terms of how climate change and health are related. But of course, it extends beyond that. It's not just those two issues. And I'm looking forward to digging into that a little bit with you. The minister from Malawi so eloquently painted a picture of the kinds of realities that her country are already facing. And we know that back home in the United States, there are also these types of crises that are emerging. So to start us off, amidst this growing recognition that health security, economic security, climate security, of course, national security are interrelated, tell us a little bit about the U.S. Global Health Security Strategy and what it hopes to achieve, and how you expect or hope that it will help prepare the American health system to really meet these compounding challenges.
Yeah, it's a big question. Good morning, Good morning, everyone. Happy WHA, and thank you very much, Your Excellency. It's always hard to follow you. But you're absolutely right. We are facing these challenges at home as well. So I think it's important before I get into the global work to acknowledge that. I come from the state of California, which has been dealing with fires on a regular basis. We also, I have family who was displaced Hurricane Katrina in New Orleans, and so we had people losing medical records and not remembering what drugs they were taking, right? So we share these experiences, these experiences, and we have learned from one another what we need to do to prepare for these tragedies. So we have on the domestic side an Office of Climate Change and Health Equity, which has been set up under our Department of Health and under the leadership of Secretary Becerra. And that is important because, of course, there is a critical intersection between climate change and health, whether we're talking about fires and floods or we're talking about lead, right? Mm-hmm. And yet, importantly, we have to also use this lens of environmental justice, which is why I have a focus on equity. This is not just about adaptation or mitigation. It is about equity at the end of the day and ensuring that climate, our work in climate and health is advancing. Is advancing this wellness and reducing disparities for all people, for all communities. How does that look in our global health strategy? Well, you did mention we have our new global health security strategy, which is absolutely bringing in same themes of adaptation, mitigation, and equity. But specifically, and I'm glad that the this as well, we recognize that it's not just about pathogens or pandemics, but we're looking at this using a One Health lens and the intersection of animal, human, and environmental health. So whether that's training field epidemiologists in the veterinary space and not just in the public health space, or otherwise looking at digital health and workforce requirements that, again, look at this intersection. These are ways we're trying to pull it all together.
That's a really bold and ambitious vision, and one that, of course, it's going to require rallying across agencies and mobilizing financing and all of that. So what are some of the barriers that the administration might be anticipating to actually enact this vision, and how do you hope to overcome that?
So are you suggesting that the U.S. is not already a well-oiled machine and our programs don't already talk to each other? Yeah, so I think the first and foremost, we have to look internally at how we can improve what we do, right? We have this grand ambition and we have good intentions. I have to start there. You know, everyone I work with understands the urgency of now and appreciates our interconnectedness. But of course, how do budgets work? How do programs like PEPFAR, you know, talk to even programs like President Initiative, let alone, you know, find other ways to sync up across all of sectors. So that's part one, is really just getting in the same room, working these plans together on the front end to understand what our respective needs are and what the resources will be that we are leveraging or using across one another. I think we saw this come together in the development of our PREPARE framework, our President's Emergency Plan for adaptation and resilience. And that was, I mean, these were huge meetings, right? But they pulled together all these parts of USG, whether it's, you know, Health, the Department of Agriculture, obviously EPA and others, along with state and our foreign policy friends. Okay, what are the problems we're trying to solve, and what are the opportunities we have to solve them? Secondly, or externally, we then have to message this, right, and ensure that partners understand these connections and the ways that we are trying to approach them. Frankly, much of this is bottom up, if we're being honest. Our partners, our ministerial leaders, right, are saying, this is actually what I need, just so you know, and I need you to make adjustments accordingly. So you have the U.S. having launched, or been behind, the launch pandemic fund, for example. We sit on the board, we work with various partners there, both from the donor community and from countries implementing these programs. And importantly, even in that space, we've said, okay, what can we do to fund One Health initiatives? And many of those preliminary projects are focused on these intersections that I'm mentioning. So that's how we're shifting the work.
Yeah, and your last point is actually a perfect segue to what was going to be my next question, which is, as we've already acknowledged, these types of challenges, whether emergencies or slow onset challenges, they transcend national borders. So tell us briefly, how are you working with other ministries of health, with multilateral organizations, and with partners from other sectors to really take forward that One Health approach? Yeah,
it's important that we're here at WHA this week and this conversation. We obviously have the resolution on climate change, which is looking at national action plans, at a roadmap. Congratulations to WHO for getting across the finish line their new global strategy, which is actually, you know, focusing on climate as one of several pillars, which is notable. So that gives us all the roadmap and the mandate to move forward in that regard, building on the we're already doing with organizations like WHO, such as through their Attach platform, really looking at best practices, exchange information between Malawi and the US, for example, let alone across other regions. I think beyond that, we are, you know, working with usual suspects like Global Fund, like Gavi. You know, these major initiatives were mentioned earlier because they too recognize the threat of climate change. And I mentioned malaria already. You know, these mosquitoes are winning, unfortunately. And so as part of this longstanding investment the U.S. has made in those programs, we have to adapt as well, adapt our thinking, adapt our doing.
Appreciate your reference to the climate change resolution and also specifically malaria, and of course it's just one of many climate sensitive diseases that are, already incredibly challenging to deal with, and then now the risk factors are only being exacerbated. Of time, but remiss not to, of course, bring up the pandemic accord. And
like, aren't we out of time?
And you are at the helm of the U.S. efforts to move that forward. And as we know, there have been some challenges. I'll ask you this: you are to use here, but what are that you accord, and the United States hope to see at least international cooperation?
I think one of the sticky issues, honestly, has been around what we do and say about One Health. And I just want to say how much I appreciate who's been around this table for so long, really, I mean, up until 3 and 4 a.m. in recent weeks trying to figure this out. There's a recognition that we have to cover the waterfront from preparedness to response. And while we absolutely need to also address another sticking point, which is access to innovations, right? And any products that come out of or spur from an emergency, we also just want to do what we can to prevent the emergency in the first place, which is where One Health comes into play. So we are still working through things, as everyone here knows, and I'm an optimist, as folks here probably know about me, so I remain hopeful we can get this done. I have to say, though, in addition to the pandemic accord, we still have the international health regulations, right, which also are looking at how we prepare for and respond to emergencies that stem from a number of hazards, including those exacerbated by climate. And that feels much closer, and it's, ideally, we have this package of agreements that comes out of this week. But if nothing else, we need something to deliver on for all of the work that our teams have done, but frankly, for all of the lives that have been lost or could be saved by getting this done too. I don't think anyone wants to, nor could we go home empty-handed after this week, because people are counting on us, right? And they've been counting on us for a long time, and we've told them that we can come through for them and that we will come through for them. So that's my goal this week. This is why I'm staying until 11:59 on Saturday, to really see this through. And like I said, I remain hopeful that we can actually achieve this.
I really appreciate, yes, I think that deserves an applause, and thank you. I really appreciate the combination of both candor and optimism with which you answered that question. So I'm going to use my chair's prerogative to ask one last. And it's this, which is, what do you feel is a global health challenge or problem that isn't getting the attention it deserves? And what's a good news story that you wish more people knew about, or a positive trend that you wish more people knew about?
Okay. Well, goodness, this is hard. I am going to go back to my roots and maybe surprise some folks, and maybe not others. I worked in cancer for a very long time, and this is something that's important to the president as well. And speaking of bottom up, right, there are people in various countries who have been saying, we care about infectious diseases, but people are dying of cancer, heart disease, and other conditions, non-communicable diseases, if you will. And so I would hope that in our ongoing conversations, we continue to talk about health systems and services, whether we're talking about them in the context of climate crisis or other crises, that we recognize the spectrum of needs people really have and be truly patient-centered to understand that, people are whole people and face a lot of different risks and needs. In terms of the good news story, that might also be surprising because I have a lot of faith in multilateralism. And, despite a lot of the hard stuff that we work through here, and there are a lot of hard things, the pandemic accord, gender, a number of issues, we are still here, and we are still finding a way through in a number of ways, right? And it's not easy, but when it works, it's magical. And so what I tend to tell my family when they ask, why are you in Geneva so much? What are you doing? I hear there's nice chocolate and wine and cheese. I say, well, I get to work with people from all over the world to try and solve the problems that you're facing right here, right? Whether it's cancer, whether it's HIV, whether it's, you know, a range of things. And we're doing it, right? I can point to ways that we're actually making a difference. Out of the 15 resolutions, right, if we get all of those through, do you know how many lives will be changed, right? Given this new global health strategy and the billions of lives saved, these are people, right? And this is progress. And so that's my good news for the day. Thank you for asking that question too, because I needed that. myself.
Well, I can't think of a better note to end on. So thank you for being here, and thank you for your leadership. It's great to have you.
Thank you, Maisha.
Thanks.
Now, please welcome Irene Atuhaire, Uganda Country Director for Seed Global Health, Darren Back, Executive Director for the Pfizer Foundation,